Well put. Another country hit particularly hard is Iran. In fact, satellite images suggest the regime there is digging mass graves as long as a football field to handle the bodies of victims. You would think it couldn't get any uglier than that, but our next guest says the United States has had an even worse response than Iran. Joining us now, the director of the Harvard Global Health Institute, Dr. Ashish Jha. He is practicing physician and also professor of medicine at Harvard Medical School, and says America's corona response is, quote, unmitigated disaster that the administration has brought upon the population. So, Dr. Jha, let's start right there. Given what you know about the data of how this virus moves and how the United States has responded, what phase are we in and where are we headed?
Yeah, good morning, Mika. It's very painful for me to use those words. The federal response really just has been a fiasco. We've had 2 months. I think Joe has been bringing this point up all morning. We've had 2 months to get ready. And we're the only major country in the world that cannot test people far more readily than we are. I mean, South Korea is doing more tests every day than America is doing, has done all, until today. So things really are a mess. And the problem is we have 1,500 cases, 1,600 cases. That's who we've identified. My best guess, and this is a guess because I don't know, we're not doing testing. My best guess is there are many thousands of Americans infected, maybe 10,000 or more Americans infected. And we can't identify who they are. We can't take care of them, and we can't, use a testing-based strategy to get ahead of this virus. And so, if your viewers are wondering why are schools shutting down, why are sport events canceled, it's basically because the federal response has been so poor that we're now stuck with these very extraordinary measures, which we hope will help. I think they will help. But boy, are we behind the 8 ball on this, and I can't believe we're here. One more quick thing, the president's tweeting about the CDC. The CDC is the best public health agency in the world, period. We all, around the world, we look to the CDC. This is not the CDC's fault. The problem here is that the administration has been trying to downplay it, has not taken this disease seriously. A week ago, the president was saying this is nothing, not much worse than the flu, while the rest of us were screaming that we are headed for a world of hurt, and the public health people have been ignored. Dr. Fauci has been ignored until recently. So we've got a real problem ahead of us.
Dr. Jha, it's Willie Geist. Appreciate you being here this morning. I think the question most Americans from the outside who don't work in the world of medicine have is, why can't we get these tests out? This is the United States of America. We've got innovators. We've got means of production. We can distribute things quickly. Where are the tests? We got news that the Cleveland Clinic is rushing out its own test now, a 24-hour test from the Mayo Clinic, for example. These other entities are stepping into the void here. But why can the United States not quickly produce these tests and get them to the hospitals that need them?
Yeah. So look, almost 2 months ago, WHO, the World Health Organization, put out a test kit. 60 countries decided to take it. We decided we weren't going to use the WHO test kit. Okay, fine. We wanted to develop our own. That's not crazy. We've got a lot of capability. But it's been one failure after another. And look, this is not about red tape. Well, there's always red tape in everything. And the whole point of leadership is to cut through the red tape, not 2 months later, but up front. And so now we're playing catch up. We have the most innovative, most dynamic scientific community in the world. I think we have a phenomenal health system. But our government has been an impedance to that, has not been helpful. The FDA has been stopping labs from producing the test until very, very recently.
Why, doctor? Why is that?
I have to tell you, you're going to have to ask the administration. I am baffled by this. I've been talking to my friends at the CDC, at the FDA. They don't understand the decision-making that's happening at the senior-most levels. It is really baffling why it is that the administration, there are, of course, theories like, well, the president doesn't want to know how many cases there are. Well, you don't want to know doesn't stop the virus from spreading. And the virus has continued to spread across communities in America. And deciding that we just want to close our eyes and pray that this will go away isn't a strategy. It's not going to work.
Dr. Jha, where you are seated right now, you're surrounded by some of the finest medical institutions in the world in Greater Boston.
Yeah.
And yet, if
Yeah.
you go 50 miles west of where you're seated, it mimics much of the country in terms of medical facilities, in terms of places to go to seek treatment. What do we do about that?
Well, let's talk about where I'm seated. In Boston, some of the best medical centers, the Brigham, Mass General, these great academic centers. If I develop symptoms of coronavirus today, and let's say I was somebody who was at high risk, if the question is, if I called up my doctor today in Boston and said, I need to be tested, or my doctor thought I needed to be tested, can I get tested? The answer is no. Almost surely not. We have so few tests that very, very few people are getting tested. Get 50 miles out, it's a complete mess.
Doctor, Joe Scarborough here. Are we making any progress? Have you heard an administrator? I mean, I understand they botched things. I understand it, right? But I'm not hearing Azar. Azar was asked last night when they're going to get tests to people. He refused to answer the question on Sean Hannity's show. Like, do you have any evidence that this White House is moving towards getting testing to Americans? So what the president promised several weeks ago, if you want a test, you can get a test, will actually happen.
Look, Vice President Pence a week ago, 10 days ago, it's even hard to remember now when, has been promising 1 million tests are going out. When I talk to state health officials and when they're trying to make plans for what to do this week and next, no one knows where those numbers are coming from. No one knows when those tests are going to be arriving. And everybody's now starting to build their own tests because there is no faith that the federal government is going to be able to deliver on the most basic thing that Iran and South Korea and Taiwan can deliver to its people. Our federal government continues not to. So I think there's just a lack of faith that when the vice president says we're going to have 1 million tests. Now, look, when Dr. Tony Fauci says we're going to have 1 million tests, I'll believe him because Tony Fauci has more credibility than anybody else in America on this issue. But the political leaders, it's hard because they've promised this to us and they're not delivering.
All right. Director of the Harvard Global Health Institute, Dr. Ashish Jha, thank you very much. Kind of very, very hard to hear some of this.
It is hard to hear, and it was hard for him to actually say it. He said it hurt him to have to say that, and this is, it's not like we, Steve Ratner, it's not like we lack the technology. We obviously
made choices.
Lack the will in the White House to get sick Americans tested. Still.
Look, we lack the will in the White House. I think it's also a failure throughout the government in many ways. You heard the doctor talk about the WHO test that we decided not to take for whatever set of reasons. We produced the test, didn't work, and so on. This is where look, you can almost trace some of this back to the stock market. This is a lack of confidence in this government and its inability to do even the simplest things like get a test kit out, and it really is quite remarkable. And I think the responsibility really goes, certainly starts at the top, but I think it does go fairly far down in our government.
Ian, Joe just used the word, we lack the will. We also lack the ability. And you might remember Steve Bannon, when the Trump administration took the White House, talking about deconstructing the federal government, deconstructing the existing apparatus of government. Do you think that this is partly, maybe mostly, what we're dealing with now, the deconstruction, the destruction of government that helps people?
You know, actually, I think you're going to find that our institutions are still pretty capable. I think there's a lot of resilience underneath the top of leadership in the U.S. government. And I think that's why we eventually do get our act together, because you've got states, you've got mayors, you've got corporations, and they have the architecture to work under. The problem is we don't have trust in our leadership. And absent, we really didn't want to have a crisis under this administration. And we got lucky for over 3 years. Didn't get lucky this time.
But let's not forget that Trump tried to cut the CDC in every budget that he has proposed. Unfortunately, he was stopped.
But he also tried to do so many things with so many strongmen leaders around the world. Think about the Russians. He was stopped. I mean, the story of Trump is how many times he's made efforts to shoot himself in the foot, both domestically and internationally, right? Shoot the country in the foot. And was unable to because the institutions are actually surprisingly resilient. And I think that at the end of the day, that will be the story when we look back on this, despite all the pain we're feeling right now, that we'll remember.
I hope so.
Ian Bremmer and Steve Ratner, thank you both so much. And coming up, we've seen a stark contrast between what President Trump and what top health experts are saying about the coronavirus. We'll talk to infectious disease expert, Dr. Anthony Fauci. And as we go to break, the global pandemic is drawing clear contrasts in how world powers are handling the crisis. While the U.S. government struggles to get its testing protocols in order, other countries may have a built-in advantage.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.